Mosquitoes carry dengue, but you can protect your family. Step 1. Use mosquito nets, especially at nights. Step 2. Install mesh on doors and windows to keep mosquitoes out. Step 3. Apply mosquito repellent to exposed skin. Stay safe. Stay protected. Prevent dengue today. A message from the Ministry of Health and Wellness and PAHO. Did you know? Mosquitoes that spread dengue thrive in your surroundings, but you can stop them. Step 1. Empty and turn down containers to stop water collection. Step 2. Cover all water storage drums and containers tightly. Step 3. Fill tires with sand to recycle and remove standing water. Together, we can eliminate mosquito breeding sites. Search and destroy at least once per week. A message from the Ministry of Health and Wellness and PAHO.
Dengue is ordinarily a mild disease. Persons may get a fever, headache, joint, and muscle pains. The illness is often resolved through rest and adequate hydration along with paracetamol to treat the accompanying fever. However, on occasions, the illness can progress to severe dengue, which can result in organ failure, bleeding, and severe fluid depletion that can lead to shock and even death. Therefore, it is important for persons who are experiencing fever, vomiting, severe abdominal pain, bleeding under the skin, feeling very weak, or getting confused to seek immediate attention. Let us work together to protect ourselves against dengue.
I love my children, and I will do anything to protect them. So that's why, as a mom and as a doctor, I made sure that my daughter got the HPV vaccine to protect her from cervical cancer later in life when she becomes a woman. The HPV vaccine is very safe and effective.
I was afraid of the injection at first, but I got it and it really wasn't that bad after all.
If there was something you could do to protect your child, wouldn't you do it? Protect our next generation. Ensure that your daughter gets the HPV vaccine today.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I want to see a Jamaica that is cervical cancer free. Cervical cancer is one of the leading causes of cancer in women in our nation, and I want this to stop. The HPV vaccine has been proven to be the most effective method to prevent cervical cancer. It is a safe vaccine, and it is best to give the vaccine to young girls before they've even been exposed to the HPV virus. So parents, I want to encourage you to let your daughters get the HPV vaccine. Let us protect our next generation against cervical cancer.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
I was first diagnosed with cervical cancer at age 33. The treatment was not pretty. It was terrible. I couldn't go to work, and I spent the whole 5 years out of work. The pain, the struggle, I removed my womb. I thought, I'm finished with cancer. 2016, cancer come back. There's hope for your daughter. My experience don't have to be her experience. So mothers, give their children the vaccine. It will be good for your sake and for the children's sake.
Don't wait. Vaccinate against cervical cancer. A message from the Ministry of Health.
Did you know? Mosquitoes that spread dengue thrive in your surroundings, but you can stop them. Step 1. Empty and turn down containers to stop water collection. Step 2. Cover all water storage drums and containers tightly. Step 3. Fill tires with sand to recycle and remove standing water. Together, we can eliminate mosquito breeding sites. Search and destroy at least once per week. A message from the Ministry of Health and Wellness and PAHO.
Good afternoon, ladies and gentlemen, members of the media. Thank you for joining us for this special conversation brought to you by the Ministry of Health and Wellness. Today is Sunday, November 16. The Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, is joined by the Mr. Dunstan Bryan, Permanent Secretary, Special Assignment, Mr. Errol Green, Permanent Secretary, Dr. Jacqueline Biseso McKenzie, Chief Medical Officer, Mr. Ian Stein, WHO PAHO Country Representative, Dr. Karen Webster-Carr, National Epidemiologist, Dr. Simone Spence, Health Promotion and Protection Branch Director, Dr. Nadine Williams, Director of Health Services Planning and Integration, Dr. Marlene Tapper, Director of Lab Services, and other members of the technical team, members of the public and members of the media. Good afternoon. Thank you for joining us again and welcome. At this time, I'll hand over to our minister who will do his presentation.
Thank you very much, Stephen. Let me also just recognize the presence of one of our critical partners, Mr. Ian Stein, who is the country rep for the Pan American Health Organization / WHO, and who has been a critical part of our health response during this time of crisis. So welcome to all. I won't bother with the introduction since that was already made. Would like to just take the opportunity to firstly hope that you're having a good Sunday afternoon, and also to reflect and to identify with those who are not having such a good afternoon because of the passage of Hurricane Melissa and the impact on those in the parishes that have been more severely impacted. Our prayers continue to be with you, and our support on the ground in all areas as a member of the government of Jamaica led by Prime Minister Andrew Holness. But as far as public health is concerned, the team here in public health at the head office, also across the country, particularly in the parishes, are out. They are active. They are victims themselves in some instances, but they are focusing on the task at hand, which is to provide proper response and good health care to the population on the ground. So in keeping with that, we've always felt that communication was a very important part of a response. We do recognize that while the country deserves the information, there are difficulties in the parishes. One could classify as ground zero, where electricity is a problem. Communication, therefore, makes it more difficult. Just to say that the discussions at this level are also taking place in those communities via town criers that have been deployed, via the many health workers who are on the ground. This past day and a half, I met with public health inspectors, community health aides, and also vector control workers in the parishes of Trelawney, well, all the parishes, Trelawney, St. James, Hanover, Westmoreland, and to a lesser extent in St. Elizabeth, and all numbered well over, I would say over 1,000, closer to 1,200 or so. We had a long discussion, and they are the foot soldiers, along with others, who are going to be in the field and will be armed with the information. So we do appreciate the limitations in terms of this forum, but we are making provisions to carry the message out. So the idea is to talk recovery. And so we say, let's talk recovery. And we know that we are far away from recovery, but it's important now that we know what the problems are. To speak about the aftermath after this storm, the issue was really accident and emergency, or recover and return to normalcy, seriously. So hence the need to get yourself checked if you have these symptoms. In addition to that, however, wearing protective gear during cleanup, avoiding floodwater, securing food and water supplies, keeping the environment clean, and controlling rodents are among the most effective steps that we need to take. I've been out there and I've seen where avoiding water, stagnant water, muddy water is unavoidable in some instances. It's not really a practical request in some cases. And so the next best thing, therefore, is to wear protective clothing, whether it's a glove or water boots or any other protective clothing, because we know that persons have to clean up, and they're doing it. They're doing it. So the key is to protect yourself. And for those Jamaicans who are supporting their family members in these communities, normally they take food items. I think while food is important, very, very important, maybe we can pivot a bit towards now supporting protective clothing for those who have to now, having passed through the storm, are trying to pick up the pieces within and around their homes to clean up. So water boots should be standard in the gift package or the welfare package, gloves standard in the welfare package, because these are all important to protect those citizens, those Jamaicans, against these types of risks, health risks. As we continue recovery efforts, the ministry urges everyone to remain vigilant. If you develop symptoms after exposure, as I said earlier, seek medical attention. Do not wait, because prompt treatment can, in fact, save lives. I want to pivot a bit to the issue of dead animals and dead animal disposal. In the aftermath of the hurricane, the safe disposal of dead animals and spoiled food of animal origin becomes an urgent public health priority. Dead livestock, contaminated meat, fish, eggs, and dairy products can quickly lead to disease, foul odors, pests, and contamination of water sources if not properly managed. As such, the ministry is working through the Veterinary Public Health Unit. That's a collaboration with the Ministry of Agriculture, and alongside public health inspectors and our local authorities to follow strict national and international standards to remove, bury, or otherwise safely destroy animal carcasses and related waste. These actions protect communities, safeguard the environment, and ensure that response teams operate safely and efficiently. Very important, again, a natural occurrence with flooding normally comes, and no electricity, comes animal carcasses that would perish because of the flooding, and of course those that can't be stored because of the lack of refrigeration. And so in that zone, we do anticipate a lot of that, and it's important that the message is out, that persons understand how to treat with that. Safe disposal is a shared responsibility involving farmers, local authorities, and residents who are encouraged to report animal deaths and avoid interfering with disposal sites. Burial is also the preferred method undertaken on high ground and away from water sources, while burning or incineration is used only when necessary. So this is very important. Throughout this process, workers must use protective equipment, disinfectant tools, practice good hygiene, and ensure vaccinations are up to date. And all activities should, where possible, be carefully documented, monitored, and followed up to prevent pest, odor, or contamination. Again, I say, you're taking things down to your friends, those who are listening who are not affected. Carry some disinfectant, water boots, gloves, the things that can help, the shovel, the pickaxe. Those are now very, very important as part of the cleanup. Not just food, but the other stuff. At the same time, communities are reminded never to use or sell meat from dead or deceased animals, and are encouraged to report carcasses through official hotlines. These guidelines are continuously reviewed and strengthened so that even in the most challenging post-disaster conditions, public health and environmental safety remain fully protected. And so it's important, therefore, that we don't take a chance because the animal just died or just perished, or is limping and looks ill but still alive. Your safety is more important than the safety of others. So please, we ask that you manage that process carefully and play your part in the disposal through burying on high ground or burning, as many people do, if that is possible and safe so to do. And so, ladies and gentlemen, we begin our deep dive into water and foodborne diseases now with our Chief Medical Officer, who I'll ask to speak first, and then our National Epidemiologist, Dr. Webster Carr, who will tell us about the concerns, where cases are occurring, and the contributing facts. So we're going to be showing some slides, graphics, so the country can be aware. And those who can see and can help others to understand through your connections by a phone or otherwise, please help us, because that's part of the communication, to relay the message to those who are not able to see at this point or listen. Okay, CMO.
Yes, thank you, Minister. Good evening, everyone. So in the aftermath of the hurricane, there's a likelihood of several factors that can cause issues affecting health. And these are, we've had loss of power, loss of reliable water supply, compromise of our food supply, sanitation breaks down, solid waste builds up, there's increased pooling of water, and where persons are dislocated and end up in shelters, then we have overcrowding issues to manage. With all of these situations, there's an increasing likelihood of a rise in infectious diseases, and this includes waterborne diseases, vector-borne diseases, foodborne diseases, and of course, if you're in an overcrowded situation, airborne diseases like respiratory tract infections, and even diseases that spread by contact. As such, the Ministry of Health and Wellness increases its surveillance and preparation to prevent and to manage these problems. Early sensitization of the population is critical, and we have been doing this through our messages that have been going out, and this is the purpose of this media brief, to really ensure that the word is heard about what is possible, and even for persons who are in areas not affected, to take the messages to their families that are affected who may not be able to hear what is going on the radio or TV or using their devices. Early assessment and detection, early detection and early treatment is essential. But what has happened is that our health facilities have been compromised. And we have spent the last 3 weeks trying to get our hospitals and other facilities up as quick as possible. But we know that we have severe challenges in terms of infrastructure, and importantly, our staff have been affected severely as well, in terms of the persons we need to treat and the persons that are doing the treatment have been both affected by the hurricane. So we have been working, assisted by various groups and organizations, both local persons as well as overseas persons. We've been working nonstop to get our facilities up. We have had 5 hospitals that have been severely affected, and these facilities are all offering services, but under challenging situations. So Falmouth Hospital, the Accident and Emergency Department is down, but they are receiving patients, and there was damage not just to the A&E, but also to the wards and to the other facilities that support the hospital. And so a field hospital has been erected, and so therefore persons who would normally come to the hospital or who have problems should still come to the hospital to seek care, and we have the use of the field hospital as well. At Cornwall Regional Hospital, bed capacity has been severely affected. It means that persons that are coming to the Accident and Emergency Department are going to face a crowded emergency department, very challenging situation that is there. But so there may be some delay. We ask for your patience, but the emergency department is still open and receiving patients. Noel Holmes Hospital has also been severely affected, but they have the benefit also of a foreign team as well as the local team that are there, and a field hospital is to be set up there so that they will be able to receive patients, and they do continue their services on a daily basis. The Savlamar Hospital, the Accident and Emergency Department as well, is crowded. A lot of persons are there. Some of their ward space have been compromised, and therefore the ability to move the patients from the emergency department to the wards have been affected. They do continue service, and they have been supported by quite a bit of local teams that have gone in to help them, and they are going to also be setting up a field hospital so that persons can come in to be seen. The Black River Hospital, most services are down at the hospital. The Accident and Emergency Department, though, is up, and it, along with the field hospital that has been placed in Black River, at Black River High School, very close to the hospital, are open to receive patients. So while we say that persons need to seek care early because we do want for early interventions, we do understand that there are challenges at the hospital, and so therefore persons must seek care, but they must understand that there are some challenging situations. And to alleviate this problem, we have been working very hard. The primary healthcare team has been out. And the primary healthcare team have been able to get back up to routine services. We have 99 health centers. We have 99 health centers in those 5 parishes. And the primary healthcare team, along with local and overseas support, have been able to get back up 60 to 70% of these facilities to normal services, meaning that if any day that you would normally have clinic, you can still go to that facility to see the doctor or to access your immunization or your antenatal care. Another 10 to 20% of those health centers have had partial services up. And that means that they are prioritizing the immunization services and the maternal care services. So where it is that the health centers may not have the clinics on the regular day, the community health aides have been out. They have been sensitizing persons to where it is, when it is they need to go to the health centers. So we're asking you to try to keep your appointments. 20% of our facilities in that area are down. And you will see the community health aides on the ground. They have been redirecting persons to where it is that they are to go for service. And the teams have been out doing mobile outreaches to try to reach persons. So while it is that, the health facilities have been compromised, we understand that at this time, persons will seek care. They need to have their routine care. But most importantly, in the aftermath of the hurricane, when it is that there will be a rise in terms of infectious diseases, and as Minister had said, some of these will present just like a normal flu. We are asking you to seek care early so that we can address the problems early, put in place treatment so that we can prevent it from getting worse. So it is challenging to everyone that is affected. And I'm asking the population for patience. I'm asking for the healthcare workers as well, because we know that they themselves have suffered, for there to be understanding on both sides. We ask for your support, the members of the public, that they will support the healthcare workers, and we really just ask for everyone that if you need to seek medical care, do not hesitate, because hesitating can make things worse. And therefore, I'm now going to ask Dr. Webster Carr to give us an update in terms of what we're seeing on the ground as to what is happening in terms of infectious diseases.
Thank you, CMO. Good afternoon, everyone. So we'll present on Jamaica's surveillance system. It's a robust system that involves many different layers. So we have a notifiable disease surveillance system with 3 classes, with class 1 being the one of high priority. There are sentinel surveillance where we select certain health facilities to check in, day out, and see what is happening, to get a pulse of what is happening on the ground. Also, laboratory surveillance, hotel, port, and even rumors. So we listen to the rumors and investigate. The enhanced system involves increased frequency of reporting on the different classes, additional sentinel sites, such as shelters, increased laboratory testing capacity, and community active search. So the class 1, these are high priority and must be notified on suspicion within 24 hours. This is called, the Public Health Act dictates that. There are many public and private facilities that should report on suspicion. So these are many, but during a post-disaster situation, there are some that we need to highlight, and these are ones that would have some response. Accidental poisoning because of poor storage practices, and persons, children especially, may drink what looks like food or drink. Dengue, tetanus, typhoid, and in a post-disaster situation, leptospirosis, and something neural tube defects. With our food situation, we're not eating fruits and vegetables. Post-Gilbert, we had increased births of children with neural tube defects. So there's something that will be under surveillance as well. So let us look at some of these. So dengue cases, so far, the cases are within low activity level. And even though we are in dengue season, but this may change over the coming weeks. It's a bit too early to see an increase in dengue cases based on what would have happened in post-Melissa. Leptospirosis, we often see an increase in leptospirosis post-flooding events, and we did see in Hurricane Beryl, and about 2 weeks after the passage of Beryl, we saw an increase in leptospirosis. Similarly, we are seeing an increase in leptospirosis post-Melissa 2 weeks after. So far, we have 11 cases that have been classified as leptospirosis based on the symptoms. So we may have gotten additional notification, but when we look at what the person presented with, only 11 would have been classified as suspected leptospirosis. So these cases are in the parishes of St. James, Hanover, St. Elizabeth, and St. Anne. We also looked at the flooding areas, and when we looked there, Catherine Hall had 2 cases, and we know that's an area that has been flooded. And so that's it for leptospirosis case. Tetanus surveillance. There are increased reports of injuries, particularly nail stick injuries, and delays in seeking care prevents the vaccination of tetanus. And we had 2 suspected cases of adult tetanus post-Hurricane Melissa, one in Westmoreland and one in St. Elizabeth. So we have sentinel sites. These sites, we added shelters, communities, and special populations to have our insight in there. Daily reports would come from these sites. And so far, we are not seeing many cases or unusual amount of any of these cases. So there are generally 9 syndromes, but during post-hurricane, fever and rash, fever, gastroenteritis, and fever and respiratory, as well as accidents and violence, are what we focus on, as well as severe respiratory infections. When we look at these numbers for gastroenteritis, we are below or we're within what is normally observed. At this time, there are no outbreaks of gastroenteritis. With respect to fever, we have no outbreaks of fever at this time, usually what we would see. And then when we look at severe acute respiratory infection, what the graph is showing is that we have entered the influenza season, which is normal for this time of the year, but we are not in alert or epidemic levels for influenza. COVID-19, it's a low activity level at this time. And then finally, what is circulating with respiratory viruses, influenza, which is the earlier part of the year. In the middle of the year, we had COVID-19. Right now, there are not many respiratory viruses circulating. We have a little of RSV, respiratory syncytial virus, and some influenza H1 pandemic strain 09. And this is what it looks like. So I hand over to CMO. Thank you.
Okay, thank you very much, Dr. Webster-Carr. I'm going to ask now Dr. Oh, okay. Go ahead, Dr. Webster-Carr. Sorry, CMO.
All right. Yes, just want to speak a little bit about the clinical picture of leptospirosis. Most persons are curious at this time. It is caused by exposure to usually urine of infected animals. That's the most common in terms of urine, but also other body fluids of infected animals, including if you have dead animals that have been infected with leptospirosis in waters, then of course that can lead to the bacteria being present in the waters and being able to affect individuals. So usually, it follows history of heavy rainfall, and we saw what happened after Hurricane Beryl in terms of the number of cases. And usually at this time of the year, we would see an increase in the number of leptospirosis cases, but of course the amount of water that is around now is a lot more, so we expect to see more cases. Usually persons who are in the fields and in water, farmers, etc., would have a high degree of exposure. And, when persons have cuts, bruises, then the organism can enter the body through those areas. And it of course, if it's contaminating the food or the drink, then of course it can enter the body through that means as well as if you have the dirty hands coming from leptospirosis infected waters, and it is touching any of the mucous membranes, the eyes, inside the nostrils or inside the mouth, then you can become infected with leptospirosis. So for most of the times, it is a mild flu-like illness. 90% of the time, it's a mild flu-like illness, and persons will take paracetamol that will relieve their discomfort in terms of their pain, their fever, and it will settle. However, 5 to 10% of cases can progress and especially go on to involve the liver and the kidney and result in severe disease. And in some occasions, less than 5% of cases, we can get involvement of the brain, leading to infections of the brain and in the fluids around the brain. It can also involve the lungs, with bleeding in the lungs and with respiratory failure. So in terms of the mild cases, in some instances, persons have no symptoms at all, so they are asymptomatic. But the mild symptoms that you will get include fever, headache, muscle pain, red eyes, stomach pain, and diarrhea. sounds a lot like dengue, and it sounds a lot like a lot of other illnesses. And so therefore, with the level of exposure that persons would have now to contaminated water, we have to have a high level of suspicion. When are the symptoms severe? If the symptoms are severe, then you will have a worse prognosis, a poorer outcome. And persons will go on to get chills, nausea, vomiting, and yellowing of the eyes is one of the common symptoms that persons look out for when they usually suspect that leptospirosis is probably there. You will see a change in the urine. The urine becomes dark or orange colored, and then the urine it becomes significantly less as the infection now starts to affect the kidneys. And then you can have bleeding at various points of the body. You can get coughing up of blood, or you can get passage of blood in the stool. You can also get an inflammation around the heart, and this presents with symptoms such as irregular heartbeat and tiredness, fatigue, etc. Shortness of breath, swollen feet, difficulty in lying flat. These are some of the more severe symptoms that you can get with leptospirosis. And by this time, you definitely should be in the hospital. How is it treated? For the mild symptoms, we treat symptomatically as we treat with most viral illnesses. Although this is not a viral illness, it is a bacterial illness, which is good because it means that we can treat it with antibiotics if we get the patients presenting early. For the severe cases, we would have to use intravenous antibiotics to ensure that the antibiotics are getting to the areas that it is needed very quickly. And so these persons need to be in hospital. If it affects the kidneys and result in kidney failure, then persons may have to go on dialysis. And if it affects the lungs severely, then we may have to aid persons' breathing by using a ventilator. But for the most part, when persons are in hospital, it is supportive care, trying to maintain the fluids by providing IV fluids, giving them blood and blood products if it is necessary. It really is dependent on which organs in the body is affected. But severe cases usually require more comprehensive treatment, and persons are treated in hospital, and some may have to be treated in high dependency and even in intensive care settings. So, to conclude, conditions exist for the contamination and the infection. If you develop symptoms, you need to seek medical care early. Treatment is available, and most cases can be treated successfully. Late presentations with severe symptoms can lead to poor outcomes. We'll go on to speak about the laboratory diagnosis.
Good afternoon, everyone. Okay, so the National Lab Services includes the National Public Health Lab and the National Blood Transfusion Service. So the National Public Health Lab is responsible for testing for leptospirosis and dengue. So we have capacity to test for both, and we have 2 PCR methods as well as serology. So we have reagents available. For leptospirosis, we have about 1,800 tests by PCR method. So one PCR method is a long method, and the other is a point-of-care rapid test. We have 40 of those rapid tests. So for dengue, we have about 1,200 tests by PCR, the long method, and 80 tests for the shorter method, the rapid method. We also have 96 tests at present by the serology method, which would test for antibodies in the blood. So we have also additional stocks that will arrive in the next couple of weeks, if not in the week to come. The short method of doing the PCR, we have capacity to also test for Salmonella, Shigella, and cholera in cases of diarrheal disease. And in respiratory illnesses, we would be able to up our testing of COVID-19 and influenza A and B with this rapid method. And we are trying to build capacity at the National Public Health Lab as well as at the Cornwall Regional Hospital. And then for the National Blood Transfusion Service, or blood bank, we do have blood and blood products available that we would be able to support persons who are in need of, especially platelets. We have adequate stocks because we've had recently increased drives to up our stocks, and we've been able to keep up with the demands. So the public has been very supportive in our recent drives, and we are now asking for your continued support in order to meet the present demands and the expected increase in demand. That's it for the lab. Thank you.
Thank you very much. So a big part of this, of course, is the communication program. You've heard the state of readiness to deal with these issues, the main symptoms, the encouragement to seek help, and the fact that help is in fact available. In the meantime, the communication strategy has to vary somewhat. I'm sitting in this room and remembering COVID and our COVID conversations, which we were able to reach every Jamaican and those outside of Jamaica. This is a slightly different scenario because of the electricity issue and people not having their own personal possession, whether TV or radio. So Simone Spence, Dr. Simone Spence, who will speak to, who is director of a health promotion and protection branch, will look at prevention strategies and look at the communications program. Dr. Spence.
Thank you, Minister, and good afternoon, everyone. So just a quick overview of some of the public health risk factors that we are taken with in terms of what we need to be communicating around is flooding, washout of sanitation facilities in most affected parishes, or damaged water systems, and therefore a reliance on untreated water sources, heightened rodent and mosquito activity, the displacement of the population and overcrowding in shelters, as well as a pileup of solid waste. So the Ministry of Health and Wellness has identified key priorities to focus on preventing communicable disease post-Hurricane Melissa. So we are looking at the availability of safe water, food safety, shelter management, general sanitation, vector control, and of course, risk communication and community engagement. And when we look at these priorities, this forms the foundation of our response, ensuring that we are guiding enhanced operational status, making sure we're aiming to safeguard community health while supporting the broader national recovery effort. So what are our concerns disease concerns post-Hurricane Melissa? So when we look at waterborne diseases, we are concerned about gastroenteritis, or GE, from contaminated water. We spoke about leptospirosis, also from floodwater exposure, hepatitis A due to poor sanitation, as well as typhoid fever. For vector-borne diseases, we are concerned about the increased transmission of mosquito-borne diseases such as dengue, chikungunya, and Zika. And for foodborne diseases, which are linked primarily to contaminated or improperly stored food, we're looking at salmonellosis from spoiled food, staphylococcal food poisoning, GE from flood-contaminated food, and E. coli from fecally contaminated foods as well. So our immediate prevention strategies center around 1, rapid assessment, which would have commenced within 24 hours post-hurricane, and establishing a public health profile of the affected communities to inform the type of interventions that we need to be putting in place. Water quality, where we're looking at monitoring our water supplies to determine the quality. Distribution of chlorine tablets to help to make water safe. Distribution of mobile water systems and containers, as well as placing safe water advisories. For food safety, we would have been concerned with ensuring that we're inspecting food and food establishments, condemnation and disposal of spoiled or contaminated foods, rapid assessment of approved slaughter facilities or fish processing facilities, dairies and registered broiler farms, as well as table egg farms, as well as placing safe food advisories as well. And for vector control, increasing the number of temporary vector control workers to add to our complement so that we can, increase our coverage, looking at larvicidal and adulticidal activities and making sure that is ramped up during this time. Rodent control program would have been expanded, as well as the deployment of the resources that are required in order to implement this entire strategy to affected areas. In terms of shelter management, we would have been doing daily assessments and reporting on the status of the shelter so we can intervene if there are any challenges. Collaboration with other ministries, departments, and agencies to improve the public health conditions at these shelters. In terms of general sanitation, improving access to sanitary facilities, so supporting the community in terms of building pit latrines in critical areas, for example, the removal of bulky waste, as well as the immediate burial of carcasses. In terms of risk communication and community engagement, we would have activated our daily risk communication messaging using both traditional and non-traditional media channels. So Minister would have mentioned about the town criers, which have been going out, playing our PSAs around the different safety messages. We are using social media, as well as mounting signs in strategic areas in terms of warning, for example, around contaminated water sources. Individual and group education sessions in communities and shelters supported by flyers and other IEC materials, that is information, education, and communication materials, especially supported by our health promotion and education officers, along with our community health aides, and really all the healthcare workers are sources of information and are expected and do hand out information around key messaging at this time. Collaboration with our key partners to share health messages widely and make sure that the messages that we have are designed to target communication, especially for our vulnerable groups. So at this point in time, we're working with both community and faith-based organizations in order to build their capacity around delivering these key health messages. So some of our key public health messages would center around use of safe water. So how do you make water safe? Boiling, if that is possible, chlorinating, or using bottled water for drinking, cooking, brushing teeth, and washing fruits and vegetables. But importantly, we need to make sure that when we make the water safe, we are storing it in clean and covered containers in order to prevent recontamination of that safe water. Food safety. You want to throw away all food that is touched by the floodwater or spoiled due to power outages, because that can result in GE. Hygiene, washing your hands with soap and water, safe water, after using the toilet, before preparing meals, and before eating. In terms of sanitation, keeping fecal waste away from waterways, yards, and in children play areas. For leptospirosis prevention, the key health messages would center around avoiding floodwaters, mud, and stagnant water if possible, wearing protective clothing such as water boots and gloves during the cleanup activities, and keeping food and water protected from rodents. For mosquito control, it's important that we empty containers that hold water, use mosquito repellent, and also allow our vector control teams to fog and to conduct inspections in and around your homes. For waste disposal, ensuring that we are bagging our garbage securely and use designated storage and collection points, and that we do not dispose of waste in bushes, gullies, or waterways. For healthcare access, seeking care immediately if you experience vomiting, diarrhea, or fever, severe muscle pain or red or yellow eyes, because that's possibly leptospirosis, and persistent abdominal pain or dehydration. Next slide. And so the ministry at this time remains committed, of course, to protecting Jamaicans from post-hurricane disease risks. Prevention saves lives, strengthens resilience, and ensures that we all have a healthier future. Thank you.
Thank you very much, Dr. Spence. So we've essentially given an overview with particular focus on the issues around water and foodborne health risks. There's still a lot to comment on, but we will continue the updates in the days and weeks to come, focusing on different areas, including staff welfare, the state of our hospitals, the state of our health centers, the particular services we're focusing on, the collaboration with a host of partners, including the Spanish through the hospital in Falmouth, Samaritan's Purse in Black River, and one coming this week from the people and the government of Barbados. So a lot more to comment on, but we want to try to do it in bite sizes so that the Jamaican people understand and appreciate. I want to make an appeal before the question comes in, and that is pay particular notice to the particular context of these discussions. You may have to be the primary purveyors of information to those who can't hear us. You know, one of the interesting things about Jamaica is that we are kind of related to somebody in almost every parish because we're quite a mobile people, or we know someone in every parish. And one of the things that we need to do, I think, is to the extent that we have our own method of communicating, whether through the traffic going down on a weekend or through the phone because you have a Starlink or access to it, I think it's important to provide that information to your friends, your families, your relatives in the parishes that are affected to the extent that they are out of touch. So you're going to have to be a key part of that source of information. Beyond that, another very important thing to recognize, as Simone said, is the issues around the town criers, the community meetings, the signs that are going to be put up where people congregate. You know, I saw people at the river side, you know, bank of rivers and streams, you know, doing their washing and so on, collecting water. We're going to have to use the many workers in the field, public health, primary healthcare workers, whether vector, public health inspectors or otherwise. All will have to be part of that communication because, again, mass media will only inform some in this case, at least for the time being. So that's going to be very, very important. I want to comment on two other things. We had mentioned leptospirosis and identified some parishes. And I just want to clarify, maybe the question will come up, that the areas of Catherine Hall, those areas where massive flooding and mud overrun the homes and the communities, the Prime Minister has given special instructions for those areas to be cleaned up. I know there's a very big special operation taking place in and around the Catherine Hall area in St. James. Ministers Wheatley and Morgan have been assigned to that ground zero, working with the mayor of St. James. They have removed, I'm told, you know, over 1,000 loads of mud, waste, and are continuing with the fire brigade and others to wash down and to clean that area. So it's happening, again, as part of the mitigation measures. But, you know, it takes all of us to do it, and I just wanted to outline that. Someone asked about mold mitigation. And I have here in-house Mr. Michael Williams, who is head of, what's your title again? Environmental Health. There are some long titles, but Environmental Health. And someone had reached out to me about mold. Mold infestation in homes and offices is a very common occurrence due to the presence of excess moisture and mold spores, which float in the air. It can be reduced or prevented by reducing moisture. So as people would say, sun out the place, open it up, open up the windows and the doors. Prevent by reducing moisture and regular cleaning and disinfection of surfaces, doors, walls, windows. So not only sun out, but we have to wipe down, right, Mr. Williams? And that you can use baking soda in water, mild bleach solution, restrict indoor humidity to between 30 and 50 degrees. I guess that means percent. That means opening up, right? Let the air flow through. trying to talk in kind of simple language. 1 teaspoon of baking soda to 2 cups of water can be used, and 3% hydrogen peroxide that's sold in the pharmacies and maybe in the wholesalers. And to, of course, while you're working on fixing your leaks, because the moisture will create the mold. And a couple of people have said that to me. And a lot of people are cleaning house now, wiping down, cleaning. Huh? And wear your mask while you do that, because it can also create a problem for your personal health. There is another one that asks about water trucks and cesspool trucks, and whether or not we were cross-contaminating or cross-commingling trucks that deal with cesspool road. I mean, it's a question that some people may think is the case. This is not the case. Water trucks are certified and are inspected, and it is actually illegal against the law for anyone to commingle both, and that's going to be something that will be that has always been enforced. So I just want to hopefully reassure the public that this is not the case. All right, so I'll hand over to Stephen now. These were questions sent to me, but I'm sure there may be others. Stephen.
All right. Thank you very much, Minister. So we're going to allow our media colleagues who are on Zoom to just use the raise hand feature to pose their questions. If other members of the public have questions, they can put them in the chat, but we'll allow our media colleagues to engage with the panel. Just use the raise hand feature. Other persons may put their questions in the chat. We're going to go to Emma Lewis. Yes. So if members of the public have questions, they can put them in the chat, and we are prioritizing those from the media. You can raise your hand, use the raise hand feature on Zoom, and then we will acknowledge you. Emma? All right, Emma, you want to put it in the chat? Yeah, Emma, we're asking you to put your question in the chat. If anybody else has any other questions, they can also pose it in the chat as well. All right, Emma is asking about, she's concerned about the quality of water, even underground water. Not a full question, but can we have any comments on that in terms of the quality of the water? I guess available.
Okay, so in terms of water quality and what our processes are, is that the public health inspectorate in all of the parishes monitor our water quality. We send samples to the laboratory to test for the presence of chlorine, as well as in terms of bacteriological germs, basically. So in terms of the most affected parishes, we would understand that based on the flood waters, etc., the fact that we have disrupted, potable water supply in these areas, as well as the fact that in terms of sanitation, wastewater systems would also have been disrupted. There is the possibility of contamination. And so the public health team is in the field, taking water samples and testing. And then we would erect signs once it is that we find that these water sources are not safe. In addition to which, we would have placed PSAs in the media speaking about how to make water safe, so that if persons are accessing water that is unsafe, that they know they need to boil for a certain period of time, or they can add chlorine bleach to the water in order to make it safe as well.
Can you say what we should look for in the water to know if it's contaminated or not?
Well, that's a little difficult to say, to be honest, because water can look clean, clear, and it actually is contaminated. With flood waters, for example, as well, you may have high turbidity, so it looks cloudy. So that means that you would have to ensure that you treat it. So, for example, if normally you would use, say, 10 drops of bleach to a gallon of water, if you see that the water is actually cloudy, you would have to treat it twice or double the amount of bleach that you use in that same volume of water, in terms of, and letting it stand for a period of time, say about 30 minutes, before it is safe to utilize for cooking, brushing your teeth, or, in terms of drinking as well.
Okay. She's also asking, how do you know if an animal is infected with leptospirosis?
So in terms of how you know that the animal would have signs and symptoms, as well as it is that the vets would test to see whether or not the animal does have leptospirosis. If we're talking about livestock or domesticated animals, that is. Rodents usually are carriers of the leptospira bacteria. So, and usually they are the ones that urinate on, in water or on food, which becomes contaminated, and then we consume same and then potentially become infected as well.
Okay, so somebody's asking, I think there is water coming up in Williamsfield. How dangerous is that? So I said, what about Williamsfield, where water is coming up, if that's dangerous, coming up out of the ground? In Manchester. You're aware of that?
I mean, the water, whatever the source of the water is at this time, whether it was water that came in from the sea, whether it is water that accumulated after the rains, whether it is water coming up out of the ground, we have to assume, the best thing to do is to assume that the water is not safe and to take the necessary precautions. Please, just assume. You can't differentiate where water is coming from at this time. It is better to take the precautions, assume it is unsafe, and protect yourself.
Okay. And I think somebody's asking about the fogging schedule. Dr. Spence?
So at this time, the fogging schedules would be posted. And they have been in the newspaper. I think today's newspaper would have carried, at least for 1 week, the coming week, the fogging schedule for each parish. So not only the most affected parishes, but all the parishes across the island.
All right, I think that's all the questions that we have now. Minister, so I'll turn to you for your closing remarks.
Okay, thank you very much. So, ladies and gentlemen, thank you very much for joining us. This is an attempt at continuing or certainly extending the conversation around the response, the health response to the Melissa disaster that the parishes have had to confront. We will continue the conversation as necessary. As I said, still a lot more to report on, but it was important for us, I believe, to focus on this particular challenge at this point in time. So, for those who are listening, enjoy the rest of your Sunday evening. For those who are not, to the extent you can reach out and provide some encouragement and information, we ask you so to do. Thank you very much, and we will keep in touch. Thank you.